Good morning everyone. My topic is study of orbital vessels by color Doppler imaging in diabetic patient without retinopathy. Diabetic retinopathy is a form of microangiopathy and is the most common ocular complication seen in diabetic patient. As life expectancy increases, the incidence also increases. Severity of hyperglycemia followed by duration of diabetes is the most important risk factors. Complications include diabetic macular edema, vitreous hemorrhage and fractional retinal detachment. Multiple methods are there to evaluate diabetic retinopathy, which include direct and indirect ophthalmoscopy. Other imaging modality like color fundus photography, fluorescing angiography, optical coherence tomography and B-scan ultrasound with color Doppler imaging. Coming to color fundus photography, it's useful tool to monitor for the improvement and progression of diabetic retinopathy, and easy to use, highly available, and can be utilized to assist documentation. But we can't confirm clinically significant macular edema, and fine detail is often not apparent, and it can be difficult to obtain a good imaging if media is opaque. In case of FFA, it's gold standard to confirm the diagnosis of neovascularization in PDR, but like other contrast studies, there are side effects like transient nausea, vomiting and anaphylactic reaction. So coming to color Doppler imaging, it's safe, non-invasive and easily reproducible method for evaluating hemodynamic alteration in orbital and retinal vascular disease. Orbital vessels can be easily identified because of color Doppler shift is encoded in color and is superimposed on a two-dimensional grayscale ultrasound image. In this way, circulation of ophthalmic artery and central retinal artery can be investigated. Assessment of blood flow velocity, including peak systolic velocity, end diastolic velocity, and resistive index, is calculated for each retrobulbar vessels at the same time. Advantages include it can easily image ophthalmic artery and posterior ciliary artery as these vessels are inaccessible by fundus, FFA and laser Doppler velocimetry, and it can image central retinal artery if media is opaque, and morphologic and vascular information in various other ophthalmic diseases like hypertensive retinopathy, glaucoma, ocular ischemic syndrome and orbital tumors. And it's also useful in measuring the progression and severity of diabetic retinopathy, and it can also use it to dictate the flow velocity post-span photocoagulation. Aim to evaluate the hemodynamic alteration in orbital vessels such as ophthalmic artery and central retinal artery, and to compare the peak systolic velocity and diastolic velocity and resistive index of ophthalmic artery and central retinal artery, and the color Doppler imaging in differentiating diabetic patient with and without diabetic retinopathy. What is resistive index? Is a measure of peripheral vascular resistance. It's not altered by angle of Doppler since it's a ratio, but Vmax and Vminimum is altered by angle of Doppler. So it's useful to measure to study the difference between various group of patients, and also we can avoid inter-observer bias. Resistive index is equal to P systolic velocity minus end diastolic velocity divided by P systolic velocity, and systolic by diastolic ratio is equal to P systolic velocity by end diastolic velocity. Materials and method. To evaluate, we evaluated 40 diabetic patients with 20 are with retinopathy and 20 without retinopathy with direct or indirect ophthalmoscopy, and we referred to radiology department. From the color Doppler evaluation was done, and Doppler spectral analysis of ophthalmic artery and central retinal artery were done. The peak systolic velocity and diastolic velocity resistive index were calculated. Inclusion criteria include patients with duration of disease from 2 to 15 years and diabetic patient with and without retinopathy. I included moderate, severe and very severe NPDR and PDR patients, and age group 39 to 73 years, and both sexes were included. Exclusion criteria is with patients with a history of congenital orbital pathology, trauma, infection, inflammatory lesions, benign and malignant lesions in orbit and cerebrovascular insult, hypertension, dyslipidemia, glaucoma, history of smoking, intake of drugs causing vasodilation. Here, after my observation, the resistive increase in case of control and diabetic retinopathy. Here, the first case we can see the resistive index is increased. It's normal in diabetic retinopathy, but it's increased in increase in case of patient with diabetic retinopathy, and we can see it's very much increase in case of patient with retinal neovascularization. Result: resistive index in central retinal artery and ophthalmic artery of patient with diabetic retinopathy was significantly greater than without diabetic retinopathy. Clinical implication: hemodynamic changes can be picked early on color Doppler as compared to retinopathic changes, and it provides opportunity for early intervention and also prevent the need of photocoagulation. Conclusion: resistive index is used to assess the index in progression in diabetic retinopathy.
That was a new topic. Good. So, in what way do you think this is useful to us?
Actually, madam, with this color Doppler, we can find out this the hemodynamic changes will occur before retinopathic changes. So we can early innervate in case of diabetic patients. And actually, these are seen in every vascular lesion. So that's why in my exclusion criteria, I excluded diabetic, hypertension, dyslipidemia.
So, this will be useful in CRV, any vascular occlusions also.
Hemodynamic changes will occur earlier. They will occur only after occlusion, no? They will occur only after occlusion.
No, sir. In case of atherosclerosis, and all, that resistance will increase more.
In diabetic, what is the pathogenesis?
In diabetic, there will be
NPDR, for NPDR.
first, in case of there will be chronic hyperglycemia, which causes alders, reductive changes, and age-related.
Ischemia is delayed relatively. Vaso-occlusion is next stage. Initially, there will be
Microaneurysm, which there will be pericyte loss, which cause pericyte death, which cause endothelial cell loss, which will cause hypoxemia, hypoxia.
those changes we cannot assess on Doppler, no?
And
In early stages.
no, this pericyte loss, everything is occurring because of this vascular changes, my friend. So, thank you.
In how many cases it was useful in detecting, in your experience? In how many cases it has been useful for you in detecting early detection of any diabetic retinopathy or vasculitis? You told us that it detects early in diabetes or vasculitis cases. In your experience, how many cases did you find it useful?